Sister said, I know a lot about healthcare. I know a lot about it because I've been in it so long. When she asked me how long, I said too long to tell anybody about. But a long time and a lot of experience. So kind of seen healthcare over the whole spectrum of time, as many of you have too, even if you may not be on the provider side. So it's a topic of great interest because it's in crisis. It's a tremendous crisis in today's society, and it's something that we're all affected by, obviously. So I wanted to kind of go through some of the issues that I think we're going to have to address in many different ways. Healthcare, I believe, is a fundamental human right. Okay? And if people don't believe that, then you can accept the crisis. But if you believe that every one of us has a right to health care, then you're going to be able to see where we've got to do a lot of work going forward. We believe it's a fundamental human right because we believe that all persons are created in the image of God. Okay? So that's kind of fundamental, almost indifferent to whatever your faith tradition might be. If we believe that we're made in the image and likeness of God, then we know that health care is very fundamental to our life. So it's essential that we promote and certainly protect that inherent dignity that everyone possesses. Health care is something that we all need, and we'll all need it in different doses throughout life. And we've all had lots of experiences. So we go forward saying healthcare is a fundamental right that every human being made in the image and likeness of God is due. So then we say, well, what are the challenges then that we're faced with today in terms of healthcare delivery? Well, first of all, there are 47 million Americans who don't have access to health care, and 9 million of them are children. Obviously, that's about 15% of our population in this country, so it's a very large number. And Sister mentioned that I chair the Cover the Uninsured Coalition. Actually, that's been in place since 2003, and it was an effort by the Robert Wood Johnson Foundation to try to help people to become more and more aware of this problem. Interestingly enough, when we started the coalition, the number was, I think, 35 million. And each year that we've come together, and this coalition is made up of providers from all around the city, well, we thought maybe we could tackle that, okay? So we worked hard on it. We gave lectures, we had health fairs and so forth. We were on TV many times through the year with our telethon. And what I think our aim was to try to raise awareness, but also to try to help people to get coverage. This year, here we are, 2008, the number is not 35 million, it's 47 million. So in some ways it's a little discouraging. I like to think that we have raised awareness, but the problem is we haven't been able to incite the will to fix it. And so we're going to talk a little bit about that. Medicare is projected to be bankrupt by 2017. Okay. Now, looking around the room, that's going to affect several of you in this room, myself included. Myself included. And so it's a serious issue. It's a serious issue. And we'll talk a little bit about how did we get there? How did that happen, when we thought we would be covered for life? Okay. Healthcare spending is out of control. It's absolutely out of control. And I'll show you how in this country we're spending so much money on healthcare. Well, we don't have the best health care in the world. We really don't. Workers are experiencing increasing out-of-pocket costs. And that's for individuals covered by Medicare as well. huge out-of-pocket costs that are really making it very difficult for people, even who have insurance, to afford health care. Employers are experiencing double-digit inflation in the cost of providing for health care insurance for their workers. I think we've all read about the auto workers in Detroit, and they tell you how much the cost of the car is due to the cost of providing health care for their workers. You know. And that's obviously, a lot of those workers are no longer even employed because of tremendous layoffs. That's just one company across the nation. Employers are experiencing the same phenomenon. Those baby boomers, they're turning 65, okay? That's a huge cadre of the population that is going to be going into the Medicare bucket, okay? So that's going to be a tremendous strain on the healthcare system. We already know that the largest subset of the population is over 80, okay? So people are living longer, but part of the problem is they're not living with good health. They're living with multiple problems, chronic disease, and so forth. So this is straining the healthcare system. And then we do know that the United States is ranked 37 out of 191 countries in overall healthcare system effectiveness, despite the fact that we're spending more than any nation in the world on healthcare, okay? And the proportion of the gross domestic product is reaching around 20%. That's huge. That's huge. So, what are we going to do about this? Let's look a little bit closer at some of the issues, because this problem of having 47 million Americans without health care coverage is extremely taxing all of society. It impacts not just those who are uninsured, but everybody else, because somehow it has to be paid for. And it's paid for in a lot of ways that you might not think. It's paid for by taxes, the taxes for Medicaid and Medicare, but it's paid for in the rates that insurers are really requiring. So it's hidden in some ways, but everyone is paying for it. These 47 million people are getting sick, okay? Many of them are not seeking care early enough. They're waiting because they feel they don't have access until they're very sick. And the cost then for that care continues to rise. So let's look at another perspective of it. Just in terms of New York State, there are over 2.7 million people just in New York State alone. That rate is about 14.2%. When we try to get some figures, and these are kind of not hard figures, they're hard to get, but these are the estimates that the counties, and we're getting that off the website from the different counties. So about 35,000 people in Broome, Tioga, and Shenango counties, which is about 15%. So it's really, it's right at the national average that we're affected. So it's a lot of people, okay? It's a lot of people that are out there not covered. It's interesting, you know, the way we're gaining access to health care is through insurance, whether it's public programs or private insurance. It used to be, maybe a decade ago, about 70% of the employers were providing health insurance for their employees. That's now down to about 60%. So even people who are working, many of them are not covered. So it isn't just 47 million people who are out there who don't work, and therefore they aren't covered. It's because many employers are not providing. They cannot afford to provide health insurance for individuals. So Medicare is headed for bankruptcy. Healthcare spending in 2007 was $2.2 trillion. I don't even know what $1 trillion would look like. That's a lot of money. It's a lot of money. Medicare covers over 43 million people, and that's obviously every day it's rising in terms of the number of people that are in Medicare. Seniors are paying a lot more out of pocket than they have done in the past. For example, hospitalization deductible, every year in January, it goes up, okay? Hospitalization, each hospitalization for a Medicare individual has a deductible of now $1,000, okay? Now, I remember the days when, it was, 400, 500. It just keeps growing every year. Increasing deductibles, as I mentioned. The Medicare projection for 2017, that's only 9 years away, okay? Hopefully, it will be solved. But that projection is coming down closer. They thought it would be further out. It looks like it's coming sooner than they thought. The projected cost for health care in 2017 is $4.3 trillion. So you can see the healthcare spending just in those years is going to double if we do nothing. There are many people who have Medicare who also have supplementary insurance, okay? And that's because of all the copays and the deductibles that they can't afford. But there's a large segment of individuals on Medicare who can't afford supplemental insurance. So they are in a real predicament because they can't afford to pay for the premiums for supplemental insurance, but they also can't pay the deductibles without it. U.S. spends more on health care than any other nation in the world. And in fact, which I think is interesting, there are only 2 countries in the world that have the industrialized countries that have an insurance-based program. You know what the other country might be? The United States is one. Pardon me? Canada, no. Canada actually has a universal coverage in Canada, as most countries do. The other country is South Africa. South Africa. And if you know anything about South Africa, it's carrying an enormous debt payment as a result of the apartheid years when they, really had so much debt to other countries. And so now, after apartheid is gone, the people who are oppressed have to pay off the debt. So there's really no way that they could afford a universal system. So we're not among the many, we're among the very few in terms of the healthcare delivery system that we have in place. Reimbursement is also, in this country, is based on how many procedures we do to people. That's the way it works. That is kind of the craziness of the way the reimbursement system is. And we're talking specifically about outpatient care, which makes up the majority of healthcare. People might think it's the hospitalization. That's the smallest piece. For example, at Lourdes, 75% of all the healthcare delivery that Lourdes does is on the outpatient side. Only 25% is acute care on the hospital side. And that is the direction that healthcare in general is going because we've made so many advances in healthcare. We have so much technology. We have made so much progress in the way surgery is done that people no longer come in for a lot of, for example, surgical procedures that they used to come in and stay for a couple of weeks. So now what is on the acute care side, the majority of what is on the acute care side is all medical. Okay, it's congestive heart failure, it's diabetes, it's all the medical problems that we'll see on the acute care side. So a real shift in the way health care is delivered. But reimbursement is procedure-based, which means the more CAT scans that get done, the more colonoscopies that get done. That's how reimbursement is based. Okay? So it's kind of a quirky little system that the government has set up in terms of how providers get paid. We have payment for sickness. We need to shift to payment for prevention. You know, very few payers will pay for prevention. You have to get sick first before you'll get health care, which is a kind of a perverse way of trying to deliver it. National spending, and this just is kind of a graph that kind of it shows us a little bit about what's happened. This is, for those of you who can't see, this is 1960. And what it's showing is the cost and expenditures for health care as a percentage of the gross domestic product. The two biggest drivers in health care cost are technology and pharmaceuticals. Technology and pharmaceuticals. And it has gotten worse. You know, probably in the maybe early 80s, the famous CAT scan entered the marketplace. Okay, it was a wonderful technology. It was, you know, it provided us opportunities to really diagnose things that we couldn't do before. I remember when it first came out, I happened to be in Connecticut at the time, and there was great consternation because the government was restricting how many CAT scan machines could be in a market, okay? And there was a lot of fighting over it as to what provider would get it. And before long, they took the restriction off, and everybody had a CAT scan. So now today, it started out as the CAT scan was at a certain level of technology. But of course, the developers of technology keep developing the bigger and better. Okay? So it starts at 16 slices that they can see. Okay? Today, they're coming out now, after all these years, with a CAT scan that will be able to see the level of tissue 120, okay, slice. It's pretty phenomenal technology, and nobody will say that it isn't. But someone might say, is that necessary? So the percentage of the gross domestic product, you can see in 1960 up to 2015 how that has increased over the years. I mean, you can see it from there in terms of the graph. There seems to be no stopping for it to go up higher. Then there's the whole workers spending more out of pocket. Tremendous copays on services that they receive. The deductibles are very high. This is with insurance. Most of your workers are not on Medicare. Most workers are on insurance. And there's a rise in the premium share. Okay, the employer pays a premium for their workers to have health insurance. It used to be 100%. How many can remember when it was 100%? Yeah, I can remember it was 100%. But I don't know of any anymore. So what's happened, because the cost has been so astronomical, the employers can't afford to keep paying 100%. So they say, well, it started with, well, you know, workers would pay 10%. Then it was 15%. And there are many employers who are really doing a 50-50 on the premiums, okay? Now, premiums for family coverage insurance plan runs around $10,000 a year, okay? So it's a lot of money, okay? And what we're finding now, that the people who are uninsured, and we said they're working, some of them are working for employers who provide insurance, but because of this, they say, I can't afford it. I can't afford it. And that is a serious serious problem. And it's a great temptation even to younger people. When they see their premium costs in their paycheck, they say, oh, I think I'm healthy. I'm going to drop my insurance. Okay. Then something catastrophic happens. They're in a car accident. They're diagnosed with cancer. Okay. We see them every day. We see them every day. So, I know from our own situation, the number of, they're called self-pay because they come in, they're self-pay. But nobody can self-pay today because nobody could possibly afford that. Okay. So self-pay usually equates to no pay. Okay. And that's a huge number everywhere today. This just kind of shows you the rise in the premium costs, okay? And that goes up every year, and that's set by the insurers, And it usually goes up 10, 12% a year. That would be the total cost, okay? Lourdes has we're self-insured. And they might say, that's pretty risky. Yeah, I think it's pretty risky, but we've decided to try to do that, and we've done that for several years now, and we're not thinking even of changing that. But we still we have to pay those premiums because we have to use a third party to manage all these claims. Okay. So tremendous growth in the premium share. Out-of-pocket spending, same thing. You kind of see what's happened. There's a lot of effort here to try to cut the pharmaceutical costs by using generic drugs. Just talk a little bit about pharmaceuticals because it's an interesting area. We are assaulted every night on the TV about ask your doctor for the newest, the greatest new drug for whatever ails you, from the sublime to the ridiculous. And, part of the rise in healthcare cost is the consumer. It's us wanting everything. We kind of think that we can find the magic bullet for whatever ails us. It's a problem. It's a problem. I think it was Dan Callahan quoted this. He says, you might think it's a joke, but Americans, think that somebody's going to come up with a cure for death. So employers experiencing a rising cost of providing health insurance, that's a big one. They just can't sustain the costs. So they either give up the health insurance altogether or they increase the premium share to the point where people can't afford it anymore. I mentioned the Detroit auto industry and how that really has significantly impacted their ability to produce their product in a competitive environment. It's kind of, that's the story of what's happened. And I'm not saying insurance and healthcare was the only reason, but it was a big piece of it. So, healthcare is a major domestic policy issue. And we're hearing about it all the time. And I think, it's one that we know is on the political agenda this year for both the Republican and the Democratic Party. It's bouncing around in terms of where it fits. Earlier in the year, it was on the top of the agenda. Then, Iraq went back up on it, and now the economy, because everyone is so concerned about the economy in this country. So those are kind of the three top agenda items. Immigration is probably in there as well, in terms of what are the highest policy issues in this country that we really need to address. So is America ready for reform? It's long overdue. But guess what? We've been at it for a long time. Famous last words. We must develop a national health program for all areas of the country and all groups of our people. Harry Truman, 1947. Richard Nixon, 1971, good health care should be readily available to all our citizens. I am announcing a national health insurance program. Jimmy Carter, 1976, it is time for a nationwide comprehensive health program for all our people. Let us agree on this. Before the Congress finishes its work next year, you will pass, and I will sign, legislation to guarantee health security to every citizen. Bill Clinton, 1993. And it just it has gone on for decades. So, are we at a different place today? So the problem, we are, as a nation, are really invested in a healthcare financing system, okay, in which 85% of the people have health insurance, 15% don't. 15% are disproportionately in the lower income brackets, right? They're in jobs that pay lower income, that don't offer health insurance, or they offer it and they can't afford it. Okay, so it's that 15%. They are less likely to vote and definitely don't make campaign contributions. Okay, so we have no health care system. We have a health care financing system, and that's a big problem. So, what is it when we're looking at this campaign, 2008, it's in front of us every night on the TV. Universal coverage, what does it mean? How do we get there? And what do we need? Well, when we're looking at, those who are developing public policy, we need to know what it is that we want to make sure is in that public policy if we're going to really change the system. We need adequacy, affordability, and availability. Okay. Adequacy, it needs to cover a certain minimum, okay, of care. And what happens is that people, and usually people of higher income, know about more sophisticated technology and will choose to do that. They'll go on the higher cost. But is there something a plan that would at least provide basic health care for everyone? Okay? And could it be affordable for everyone? And access has to be available. So it's really a call for justice. And certainly you're here because I think you're concerned about justice in our society. This was a letter written by the American bishops in 1981. Because we believe in the dignity of the person, again, that's calling on that fundamental moral imperative, we must embrace every chance to help and to liberate, to heal the wounded world. As Jesus taught us, our hands must be the strong but gentle hands of Christ, reaching out in mercy and justice, touching the individual person, but also touching the social conditions that hinder the wholeness which is God's desire for humanity. So it's another way of saying what is that moral imperative, and this is what it's about. And obviously healthcare fits into this. Okay. So what is our vision of healthcare reform as a faith community? Fundamental to a healthy society, okay? Because when one is sick, many others are impacted. And I don't mean just because they might be contagious, but they're impacted. If you have a family member that's ill, all of the impact of a lack of wholeness in healthcare. It's not a product or a commodity. And, in some ways in our society, we've made healthcare into a commodity, okay? As we do with so many things in our country. When people have unmet health needs, it is difficult for them to fully function as members of their families, their workplaces, their schools, which then affect the broader community. Okay. So what we're trying, this is a quote from the Catholic Health Association, and there are many large associations that are trying to impact public policy on this issue. So you're not alone. There are many that are working very hard on it. Lourdes belongs to a national health system called Ascension Health. And you have a group of people from Ascension Health who have an office in Washington, that their full-time responsibility is trying to work on impacting public policy. Okay. The core values that need to drive this reform: human dignity, that's where we started, concern for the poor and the vulnerable, okay, because they have less voice in making this happen, and their needs are greater. Okay. Justice, and again, health care for all, so that there are no segments that should be left out. The immigrant population that you mentioned, those who are illegal, they're human beings. They still need health care. We can't exclude them from that. The common good, that kind of gets to, can there be at least a floor of health care benefits that everybody has in this country? Stewardship, can we use health care services in a way that is not wasteful? We talked about the prescription drug issue and the use of brand names, the use of over-medication for trying to think we can cure every ill that is out there. How do we use the resources that we have? Pluralism, accepting the fact that everyone comes at this from a different perspective. Everyone has different needs, so that we address the needs that are out there. So, essential elements of the vision: healthcare that is available and accessible to everyone. That's what you need to look at when you're kind of analyzing what people are coming out with in terms of change in policy. Health and prevention oriented. Are those going to be included in that floor, or are they just going to be for those that can afford it? With the goals of enhancing the health status of communities. Okay. This is interesting because, as you know, in this year's budget, what Governor Spitzer was promoting was prevention. Okay. One of the problems are, though, you can't take just pieces of this and overnight switch it, because what his plan was, I don't know what will happen to it now, was to increase the reimbursement for prevention and decrease the reimbursement for sick care. Well, prevention, to have the benefit of prevention, takes a while. So overnight, you can't change that system. So again, the need to really think through changes that you're going to make in the healthcare system. Sufficiently and fairly financed, and again, a way to, be able to provide for those who are going to be administering healthcare. We talked about the huge cost of education for healthcare providers. I mean, they're all coming out with student loans over $200,000, and so that does impact the system as a whole. So there has to be some way to fairly finance it. It needs to be a shared responsibility for all stakeholders. Okay, now how that's shared is part of the policy development. And maybe it is taxes. That people will have to pay more taxes. And we know that if you go to Canada or you go to Europe, there's huge taxes. But they get their education covered, they get their health care covered, and they don't have those kinds of worries for basic services that we have. Okay. Care for those who cannot help themselves. There will always be those who need help. Okay, it's just part of the humanity. So we have to make sure that everyone is covered. For example, you probably read about the experiment that's going on in Massachusetts. And that's kind of what has happened, because the federal government has not made any move to fix this. Some of the states have started to take an initiative to see, can we do that? So Massachusetts is trying to cover every citizen, and they're mandating it. Okay. Now, they're struggling. They're struggling because of the cost. Because we haven't changed the way we deliver and the way people are demanding care. So you can see how there's so many things to be fixed if it's going to work. Okay. California, Governor Schwarzenegger tried it, and it failed. I mean, it failed before they even got off the ground because they had budget problems. So it's not easy. What we're talking about is not easy, but we know nonetheless it has to happen. It needs to be transparent, consensus-driven. Again, it has to be understandable. It needs to be patient-centered. That's where this really needs to be, to ensure that services are coordinated, integrated all along the continuum. Okay, we have a fragmented system. You have a doctor for this organ, you have a doctor for that organ, and so it's not who's putting it together so that people really understand what's going on. And there are a lot of efforts, there are a lot of good things happening to try to make sure, like palliative care and end-of-life care. It's that issue, when people are so stressed with the loss of a loved one, there needs to be someone who's putting those pieces together for them in terms of what to expect. And that's something that's really beginning to happen. There's still a lot of issues with it, but it's beginning. And then in the end, we certainly need the best possible quality of health care that we can do. Okay? And our system came up with these three things. We need health care that works. Okay? You can get there. You can get an appointment. People are nice to you. Okay? You understand the bill when you get it. You can find where to go. You don't have to go long distances. All those things. Healthcare that works. Healthcare that is safe. And the media always covers all the things that can go wrong in this complex environment. Okay, so what's the biggest thing that everybody's saying that needs to be done to make it safer? Seems very basic. Hand washing. Hand washing. Okay, and so all the things that goes in. It needs to be healthcare that is safe. It needs to be healthcare that leaves no one behind. So those are the three pillars that we as a system have taken on for the past several years to work on all of the elements that are involved. If we had healthcare that worked, healthcare that's safe, and healthcare that leaves no one behind, we will have solved these issues. Okay. And so that's the kind of the paradigm that we're working in. Okay. There's a lot of work to be done, isn't there?